Now, we've got two different subjects, fat grafting and breast implants, but never the two shall meet until recently. Are patients coming to you and are they confused?
Yeah, well, I think most patients still, when they come in for a breast augmentation, are asking for implants. And there's only the occasional patient who's heard about or read about fat grafting as sort of an option, either with implants or as a standalone procedure. So I don't think they're really confused as much as they just want to have information and better understand it.
What is fat grafting?
Fat grafting is when you kind of transpose fat from an area where you have a good amount of cells to an area that you don't have as much fat. And just we very carefully put in strands of fat so it can revascularize and live in a different spot in your body.
And depending on where it's placed, does it last?
It does, a certain percentage of it lasts, and certain areas do retain it better than other areas, and it depends a little bit on your weight gain and loss.
Okay, strong opinions.
Well, my strong opinion is, this still gold standard for an augmentation still is a breast implant. It still does the best. It has the best variability, and it can make sizes much bigger than fat grafting can. They last a long time, the implants do. Patients retain their implants for many years, often 15, 20, 25 years, with really low complication rates, and with what is relatively a guaranteed result.
Do you have patients, Christine, yet coming in confused over the two?
Definitely confused. They come in, usually it's like kind of your middle-aged woman, I want my fullness back. They don't realize they've had kids, their breasts have been stretched out, and fat's it's just too loose. It's not going to give them the shape they want, nor the cleavage, and I just think it's not good for those people.
Are they attracted to the fact that it's their fat?
Definitely. They think it's natural. Like we were saying before, they think it's less work. They don't understand you need the structure of the implant.
But I think that, fat grafting, or fat, we used to think of as bad. But today I think we think of fat as good, and we use fat a lot, and we graft fat a lot. And I think using fat grafting in breast surgery, not as a standalone, but as an adjunct, either to somebody that's having an augmentation, or using it to help correct problems with breast implants, if they've had wrinkling or some other issues, and definitely in breast reconstruction.
Is there a time when you would use fat grafting along with a straightforward implant?
Yeah, if people want to have more cleavage, if they're very thin skin, sometimes they have congenital kind of variations where they have an inframammary fold that's very high, you want to smooth that out. I find fat very helpful in those situations.
Yes, I use it commonly as an adjunct. People that have chest wall asymmetries as well, I can sort of deal with that without using a larger implant to fill in some problems. I can actually use fat to fill in those problems.
Great information, guys. Thanks so much. If you'd like some more information, please go to theplasticsurgerychannel.com.